Pregnancy is an incredible journey. It all begins when an egg is fertilized by sperm. This usually happens in the fallopian tube, which acts like a pathway from the ovaries to the uterus. The fertilized egg, now called a zygote, travels down the fallopian tube. It eventually reaches the uterus, where it implants and starts to grow. Over the next 9 months, the uterus provides a safe and nourishing environment for the developing baby. This is where the baby receives nutrients and oxygen through the placenta. The placenta also removes waste products. A normal pregnancy is a delicate balance of hormones and biological processes. It's a time of great change for a woman's body as it adapts to support a new life growing inside. Understanding how pregnancy typically unfolds helps us appreciate the complexities of situations where things might deviate from the norm. One such deviation is what we call an ectopic pregnancy, a topic we will delve into in the next section. Sometimes, the fertilized egg doesn't reach the uterus. Instead, it might implant in other places, most commonly in the fallopian tube. This is what we call an ectopic pregnancy. Ectopic pregnancies cannot proceed normally. The fallopian tube is not designed to support a growing baby. It's much narrower than the uterus, and it can't stretch to accommodate a developing fetus. This situation can be dangerous for the mother. As the pregnancy grows in the fallopian tube, it can cause the tube to rupture. This can lead to internal bleeding, which is a serious medical emergency. It's crucial to recognize the signs of an ectopic pregnancy early on. The most common symptom is abdominal pain, often on one side. You might also experience vaginal bleeding, even if you think you are pregnant. Other symptoms can include dizziness, weakness, and pain in the shoulder tip. If you experience any of these symptoms, especially if you suspect you might be pregnant, it's essential to seek immediate medical attention. Several factors can increase the risk of ectopic pregnancy. These include a history of pelvic inflammatory disease, previous ectopic pregnancy, or certain fertility treatments. However, it's important to remember that sometimes ectopic pregnancies happen for no clear reason. Doctors use various methods to diagnose an ectopic pregnancy. They will likely ask about your medical history and perform a pelvic exam. A blood test can check the levels of pregnancy hormones, while an ultrasound can help visualize the location of the pregnancy. Once an ectopic pregnancy is diagnosed, prompt treatment is vital. The goal is to prevent the fallopian tube from rupturing. Treatment options usually involve medication or surgery. Medication can stop the growth of the ectopic pregnancy. Surgery might be necessary to remove the pregnancy tissue. It's understandable to feel worried about future pregnancies after experiencing an ectopic pregnancy. However, many women who have had an ectopic pregnancy go on to have healthy pregnancies later. Your doctor can discuss ways to minimize risks and increase your chances of a successful pregnancy in the future. Remember, you're not alone, and there's hope for a bright and healthy future ahead.